Improving behavioral health follow-up care, getting started on quality improvement. Hello, I'm Sue Butz-Dion, a quality improvement advisor. About 40% of adults and about one-third of children who depend on Medicaid and CHIP for their health coverage struggle with their behavioral health. Behavioral health conditions include mental health, substance use disorders, and emotional and developmental concerns. When a behavioral health crisis occurs, requiring an emergency department visit or hospitalization, it's important to have support and timely follow-up care with a mental health provider within 30 days, and ideally within 7 days. Medicaid and CHIP programs can help to ensure that beneficiaries receive timely follow-up care. In this video, I'll share quality improvement methods that will help get you started on a program to improve behavioral health follow-up care for the Medicaid and CHIP beneficiaries in your state. A great way to begin any quality improvement project is with an aim statement. An aim statement identifies key parts of your project. What do you want to achieve? Who is your population of focus? How will you measure improvement? By when do you want to see improvement? A good aim statement will help keep you and your improvement partners working together toward the same goal. Here is an example of an aim statement on improving behavioral health follow-up care. By a specific date, the state Medicaid and CHIP program will improve the timeliness of 7- and 30-day follow-up care for adult beneficiaries who visit an emergency department for a substance use and with a diagnosis of alcohol or drug abuse or dependence from a baseline percentage to an increased percentage. The aim statement anchors the beginning of a driver diagram. A driver diagram is a quality improvement tool that organizes evidence-based processes or systems that can drive the change needed to achieve your aim. The next step in creating a driver diagram is to identify the primary drivers. These are key processes, structures, or norms in your system that need to be considered to achieve your aim. For example, one of the primary drivers for improving behavioral health follow-up care, highlighted here, is delivery of integrated behavioral health care, which connects care in one setting with the next, or here, from an emergency department visit to outpatient care. Secondary drivers are the places, steps in a process, time-bound moments or norms that identify the opportunities to produce improvement in the primary drivers. The secondary driver highlighted here is processes for discharge and transitions of care. Secondary drivers lead to change ideas. Change ideas are activities supported by evidence, experience, or expert opinion, and are the ideas that we test as part of an improvement project. Building off the successes of others will help achieve your aim. The change idea shown here is ensuring warm handoffs, such as outreach to patients following emergency department discharge. Another tool that may help your team identify potential change ideas is a process flow, which is a visual display of the steps in a process. Seeing all the steps that are part of your current process can help you see what happens between the beginning and the end. You may find processes that are taking too long or not happening at all. A process flow helps you see opportunities to improve the process and, in turn, realize your aim. You'll find an example of an improving behavioral health follow-up care driver diagram and a change ideas table, as well as other resources on Medicaid.gov. How can you get started on a change idea for your Medicaid and CHIP program? Although it might be tempting to go big and simply implement a change for the whole state, it's best to start small and test your way into the most effective program and policy improvements for your state. Using small tests of change will enable you to determine whether an idea will lead to sustainable improvement in your program and with your beneficiaries before enacting policy changes. An effective tool for testing change is the Plan, Do, Study, Act, or PDSA cycle. The PDSA cycle helps you learn whether a change idea will work for circumstances in your state. Let's plan a Plan, Do, Study, Act, or PDSA cycle by testing an idea from the driver diagram and change ideas table on improving behavioral health follow-up care. We will begin with the secondary driver we highlighted earlier, processes for discharge and transitions of care. and then select an idea from the Change Ideas table. Outreach to patients following emergency department discharge. The first step is to plan. Start by asking, what question do you want to answer with this small test? For this PDSA, your question might be, do MCO case manager outreach calls to patients within 24 hours of discharge of an emergency department visit for alcohol or other drug dependence increase follow-up visit attendance? Next, decide what you will test, who will conduct the test, the subject of the test, and what tools or resources are needed to conduct the test. For this test, Gloria, a case manager at Purple Finch MCO, will make 5 outreach calls. One of the most important elements of the plan section is to identify what data you'll gather to learn whether the idea has promise. Did it work or not? Keep the data collection simple and quick. Try not to use administrative claims or other data with lag periods. The data don't have to be perfect. You just want to learn quickly whether and how this small test worked. Finally, make a prediction. What do you think will happen as a result of your PDSA? Making a prediction will enhance your learning. When you've completed your plan, you're ready to do or conduct the test. In our example PDSA, did Gloria call and reach 5 members after an emergency department visit for alcohol or other drug dependence? Next, study the data to understand the results of your test. Did your test go according to plan? What did the data tell you? How did your predictions compare to what happened? What surprised you? The final phase of the PDSA cycle is to act on what you've learned from the test. In most cases, this means planning the next iteration of your test based on what you've learned. For example, in the next PDSA cycle, test how to remove a barrier that you've learned about. Or you can test the change idea with a different population, in a different setting, or with more providers or beneficiaries. You could even test several things by doing concurrent PDSA cycles. In the example PDSA, the data showed that the case manager, Gloria, was able to reach all 5 patients and confirm or assist in scheduling their follow-up visit within 7 days. But 2 of the patients who were called did not attend their follow-up visit. When Gloria called them afterward, she found out they needed transportation and didn't know that Medicaid provided transportation to medical appointments. For the next PDSA, Gloria will specifically ask about barriers to attendance, including transportation, and work with patients to resolve any issues. Remember that testing ideas concurrently will accelerate your progress. Continue testing and learning about your change ideas by addressing barriers to improvement and, over time, increasing the size of your test. For example, if you started with 5 people, test next with 25, and then with 125. As you conduct your PDSA cycles, create run charts to visualize your data. A run chart is a graph that shows performance on a process or outcome over time. Run charts often show data in weekly or monthly intervals. Displaying data over time will show the impact of your change idea and whether it is producing the desired results. The run chart shown here captures the data from our PDSA. From Purple Finch's baseline follow-up visit rate of 40%, the first test, making outreach calls, improved the follow-up rate to about 55%. And when transportation and other barriers were addressed, up to about 70%. With the third PDSA, making reminder calls, Purple Finch was able to reach its goal of 75% attendance for follow-up visits. When you have confidence that your change idea will reliably improve behavioral health follow-up visits, you're ready to implement it broadly in the system where you conducted your testing. Good implementation includes getting buy-in from leaders and others involved, including the people receiving the benefit. You want to make sure that the cost of failure, either financially or in terms of the goodwill of your partners, is low. Broader implementation might require changes in behaviors, policies, or procedures, and could include training staff and securing more resources. After successful implementation, They're now ready to create a spread plan, a plan for expanding beyond the initial setting or population you tested into new settings or populations. In our example, you may ask other Medicaid MCOs to adopt Purple Finch's successful outreach strategy. As you expand, continue to collect data and monitor progress to make sure your change idea continues to have impact and that the outcomes are sustained. What I've presented here, identifying an aim statement, developing and conducting PDSA cycles, and implementing and spreading change ideas, is called the model for improvement. It's one of the best ways to transform ideas into strong programs and policies for Medicaid and CHIP beneficiaries. To learn more about the model for improvement and to request quality improvement technical assistance for your state's Medicaid or CHIP improvement project, reach out to CMS through the Quality Improvement Technical Assistance mailbox, Medicaid CHIP QI at cms.hhs.gov. For more information and resources, scan this QR code to go to the Medicaid.gov Improving Behavioral Health Follow-Up Care Quality Improvement Technical Assistance webpage. This communication was printed, published, or produced and disseminated at U.S. taxpayer expense.